Diabetes occurs when the body has a problem using energy or glucose it gets from food. This causes too much glucose or sugar to stay in the blood. Insulin that comes from your pancreas allows your body to use glucose for energy. But if your body cannot make insulin, type 1 diabetes occurs. When your body cannot make enough insulin or use it properly, type 2 diabetes occurs. And, while it's true that diabetes does not have a cure, you can manage diabetes very well and thrive. That's the goal of VA's whole health approach to your care. Getting VA healthcare when you need it, and taking good care of yourself every day. Self-care activities help you feel good, keep your blood glucose in a healthy range, and help prevent or delay having complications later. Let's look at some of these self-care activities now. Eating healthy, balanced meals and snacks spaced throughout the day helps keep your blood glucose in a healthy range. Healthy carbohydrates or carbs found in vegetables, whole grains, fruits, and low-fat dairy foods break down into glucose that your body uses. Although sugary foods like candy, sweets, and regular soda can be eaten, they raise blood glucose a lot, so you need to plan for them or choose to avoid them. Next up is getting regular physical activity. Your muscles use the glucose from foods for energy to help keep blood glucose levels on target. Being active also helps with weight loss, lowers cholesterol, and helps improve your blood pressure. Taking medications, either as pills or insulin shots, also helps keep your blood glucose at normal levels. Your VA provider teaches you how to give yourself insulin shots, which is a lot easier than you may think. Other daily medications may help manage blood pressure or avoid or delay having problems later. Monitoring your own blood glucose levels is often recommended, so you know if you need to make changes to your food or to your activity. Some people may check their levels a few times a week or a few times a day. Sure, managing your diabetes can be quite challenging at times, and it's normal to feel down or stressed out. That's why it's so important to have a solid network of people in your life you can turn to when things get tough. And it's also just as important to celebrate the progress you've made so far. Taking care of yourself is also about getting recommended immunizations and eye exams, quitting if you use tobacco, and seeing your VA provider regularly to monitor your long-term blood glucose and overall health. Sometimes your blood glucose levels can get out of balance. This can lead to hypoglycemia or low blood sugar, which can happen if you skip meals or wait too long to eat, or also if you exercise more than usual, or take too much diabetes medication or insulin. On the flip side, you can have hyperglycemia, or high blood sugar, if you get too sick or stressed or eat more than planned, or exercise less than planned, or also if you don't take insulin or diabetes pills properly. To help manage low or high blood sugar levels, talk with your VA provider. Together, you'll develop a plan that may include checking your blood sugar in your urine, eating glucose-containing foods, adjusting medication, knowing when to call your provider, and even alerting loved ones when it's best to get emergency care. Learning how to deal with high and low blood sugar is just one of the many ways your VA healthcare team is there for you. Whether it's developing your diabetes eating plan, learning how to test your blood glucose or inject insulin, or helping you quit tobacco, they'll guide and support you at every step of your diabetes journey, so you can live your whole life to the fullest.